and welcome to another episode of the Pharmacies podcast. And I welcome you to another new week. How has your weekend been? I hope that you had a nice time with family and friends and all of that. I know on Friday, right, I told you that I was coming down with flu and I wasn't really feeling well. I wasn't even talking very well. But today I'm happy to tell you that I'm all better. Yes, thanks be to God. I know I told you that I'll be coming back better. And yes, as I have said, so it is to me. Today, what will I be talking about? Well, I'll be talking about online pharmacy versus physical pharmacy. I know in recent years, especially since COVID-19, a lot of businesses have gone online, right? They have changed their ways of doing business. Everything doesn't have to be physical anymore. And the healthcare sector is no exception. Even in the UK, the NHS, before you go see a doctor directly, you have to book appointments online, you have to lodge your complaints online, and the doctor will have to decide if it is something you have to come to the hospital for or is something they could just recommend something for you for. I know that Nigeria is not quite there, but it is easier to integrate the pharmacy into an online thing, and that has been happening a lot lately, and Nigeria is not an exception. Now we see online pharmacies in different places, even some vendor apps, so to speak, or should I say apps that sell other things like food, like electronics and all of that. They are integrating pharmacies into their operation. Okay, so today I just want to talk about this advent of online pharmacies and what they may mean for the pharmacy profession and you, the consumer or the patient that access these services. So without further ado, let's get right into it. Let me begin by explaining what an online pharmacy is. It is an internet-based vendor that sells medications on the internet. The order is sent to the consumers via mail or courier via dispatch riders in Nigeria. I mentioned that online pharmacies have been very popular lately because of COVID-19, but they have been in existence longer before that. In the US, online pharmacies started around 1990s, but the Western world, they are faster than Africa, than the third world in catching up. We are just catching up most recently. And the thing with online pharmacy is that you can be in the comfort of your home, and order your medications, which is why I'll be talking about the pros and cons majorly of online pharmacies, what you need to know, what you need to be cognizant of, the things that you need to be careful about, to be aware of when buying your drugs online. Okay, so like I said, online pharmacies are just internet-based pharmacies. Okay, but the thing is, in Nigeria, I don't know about elsewhere, but I believe that it is still the same regulation. Okay, they are still regulated by the Food and Drug Administration of the country in which they are situated. So for US, they are still regulated by FDA and the Pharmacy Council there. Also in Nigeria, the online pharmacies are regulated by NAFDAC and by PCN, that is the Pharmacy Council of Nigeria. So you can't just have an online pharmacy without a physical pharmacy. That has to be said, okay? So when we are comparing online pharmacy to physical pharmacies, it's not like online are just strictly online. They must have a physical pharmacy, somewhere that they can be traced to. It's not like food or clothes that you can sell from the comfort of your house without having a shop. Do you understand? Now for pharmacy, there must be a physical pharmacy attached to that online pharmacy before you can actually call it an online pharmacy. Another thing that an online pharmacy must have before you can call it an online pharmacy is that it must have a registered pharmacist as the manager, as the overseer of the pharmacy. So you can't say you are a chemist now, you are opening an online pharmacy without a pharmacy license. It is illegal, okay? You can't say, oh, I just like selling drugs and let me open an online pharmacy. That cannot work. So the online cannot exist without the physical. But there are a lot of physical pharmacies without any online pharmacies attached. I hope you get me. That's the clarification I want to make on that. So how patients access online pharmacies is through mobile applications, okay? These pharmacies create a mobile app or maybe a website through which the patients can speak to a professional, order their medicines, okay? That is how it usually works. So for you to access an online pharmacy, you should at least have access to the internet. I mentioned earlier that it is internet based. You must have access to the internet. You must have your data. Do you understand? You don't really have to know the physical site of the pharmacy to order your medications. Do you understand? But it is advisable that you do, just for authenticity sake, just for you to be able to trace what you're getting to a particular location. I hope you understand me. When I say a physical pharmacy must be attached, it doesn't mean that it must be run like a normal pharmacy, if you understand what I mean. It might be a warehouse because there are pharmacies that are strictly online, that they don't do physical, do you get? But there must be a warehouse, a physical location where those drugs are stored, where they are managed, do you understand? Where they are dispensed from by a professional, by a registered and licensed pharmacist. So it's not like if you have an online pharmacy, you must have a retail outlet where people see the pharmacist face to face. No, but they could have a warehouse from which they dispatch these medications. It must have a location. That is what I am saying. Now, quickly to the benefits of online pharmacies. Number one is the ease and convenience of it. It is very easy and convenient. Like I said, you can stay in your house, take your phone, open the app, order your medicine without any hassle. You don't have to start looking for pharmacies around. You don't have to start taking your car out or getting a transport there. This is especially convenient for travelers, moving from a place to the other and who have forgotten their medication in the place where they left to their new location, or for people moving to a new area. The ease and convenience of it, the remoteness of it is one major benefit of online pharmacies. Another one is affordability and cost efficiency. You understand? It is affordable and cost efficient. Why? Because, like I said, the pharmacy might just have warehouse, so running costs will be reduced. Running cost of maybe paying electricity bill, for a day-to-day running of a physical pharmacy is higher than running an online pharmacy. That is if it is strictly online. So their product might be kind of cheaper than the physical pharmacies. Okay, they can provide discounts and deals because there's no third party. So renting of premises, maintaining a huge staff, payment of large number of staff is not there. All of that reduces the overhead costs, and this will reflect in the price of the medications. Also, the shipping cost is borne by the customer. Do you understand? You have to pay for your courier. So that money will not be part of what you pay for the drug. Another thing is it is time saving. In a few minutes, you can be in your house, order, and it will get here. Just like you order your food, your clothes, your books, just go on the website, go online, order your medicines, and they will get to you in record time. Thank God for courier services and dispatch riders. It will get to you in a few minutes. Also, when talking about time, the time you spend going to a pharmacy and not finding the product that you want would be time wasted, right? But online, if you can't access it in one online pharmacy, you can easily log out and go online to another pharmacy. You understand? Instead of going to a pharmacy physically and being disappointed at not finding what you're looking for. In that wise, it also saves your time. Then you have wide range of choices. When you log into the website or to the app, you see a lot of medications that you can choose from. You can see different brands. When you enter a pharmacy now, a lot of people complain when you ask for a medication, the pharmacist brings one out. It is the most expensive that they bring out, blah blah blah. Here, you most likely see the different ranges, the different products, the different prices. You choose at your convenience. Nobody's making the choice for you. You understand? So in that wise, it is very, very advantageous and convenient. Then confidentiality. Of course, physical pharmacies offer confidentiality, but it is still limited in the sense that it is the information you give to your pharmacist that remains confidential. But the one that you give on the floor of the pharmacy may not be really confidential. Say, for example, you walk into a pharmacy now, you want to get an oral contraceptive pill, maybe posting or two, like an emergency control. You might be feeling shy or somehow because you don't want people to see you as one kind of person, you understand? Or for some men that want to buy condoms and they are just kind of shy to buy it, or other confidential medications like that. Maybe you have hepatitis, for example, and you want to buy your antiviral medications like your tenofovir and the likes. You might be feeling somehow that if I buy this now, won't people think I have this kind of condition? The confidentiality is there. You are in your house and you are ordering it. Nobody sees what you are buying. Nobody knows where it is going to per se, maybe except the pharmacist that is dispatching it. So the confidentiality is even higher for online pharmacies. Your information are private, okay? Then it facilitates access to medical information. That is another advantage of online pharmacies. You have better access to pharmaceutical product and drug information. The online pharmacist website most times provide useful information regarding diseases, drug interactions, they even provide some very advanced ones, provide an avenue for you to chat with the healthcare provider there, ask questions about the drugs you want to get. Do you get? That's the ideal thing anyway. So it helps you to actually have access to this information. There are many barriers to communication between the pharmacist and the patient. When you walk in, there might be a lot of traffic, a lot of people on ground already. You might even be in a hurry after waiting a while and not want to ask your questions. But the online pharmacy gives you a chance. You can leave your message in the chat box and somebody will surely be there to attend to it. Of course, if there's an online pharmacy, there's website, there's an app, there will be designated staff to see to it that all queries are answered on it. Do you understand? So that gives you the edge instead of having to wait in line or wait hours or minutes to actually speak to your pharmacist, and maybe not even as freely as you want to. And lastly, the advantage is that there is easy and secure payment methods. This one is actually dicey. It is dependent on a lot of factors, dependent on how well the website was built, how well the app was built, and all of that. But this is the ideal thing. Okay, how to pay is very secure. You don't have to get to the pharmacy. Thank God for advent of all these digital banks now. It has made things easier. But in the past, you go to the pharmacy, you want to pay with your card, you can get declined, you make a transfer, you might have to stay hours to confirm if the money has actually entered the account of the pharmacy. But all this have been taken away in the online pharmacy. You pay in your house. It's after you've paid, you check out before your drug is delivered. It's not like you need a drug now. Maybe somebody who has asthmatic attack, for example, you enter the pharmacy, you quickly get your inhaler, you use it, then to pay now becomes a problem. Your bank is not working, your bank app is faulty, and all of that will not be there. That is advantage of online pharmacies. Okay. Now, to the disadvantage of online pharmacies. I've talked about the benefits so far, right? Let's talk about the setbacks, the cons. We've talked about pros, let's talk about cons. Lack of immediate access to medications. The last point I made about the emergency medication like an inhaler, that cannot happen online. You have emergency now. It's the physical pharmacy that can help you. So there's no immediate access. After you've paid and you've checked out, you are expecting your medication. A lot of things could happen during logistics that the drug will not get to you on time. You understand? So that is one disadvantage. You don't have immediate access to that drug. It is subject to getting to you over time. It's not like you have it in your hand immediately after you've paid. Then, the growing use of online pharmacies has deprived patients of physical encounters and face-to-face discussion with professional licensed pharmacists. And that is the truth of the matter. There is a limit to the kind of information you can even share online, as confidential as it may be. The back and forth from asking questions and answering in real time, you cannot take it away. There's a great advantage to it that even your physical outlook can help the healthcare provider to actually guess what is wrong with you, then follow up with relevant questions, which may not be so online. It is the information you give, which is subjective, that they will work on, and it may not be as effective as going physically to the physical pharmacy. Okay. Prescription medications, you cannot get them online. This is one point I would like to really emphasize on. You can't get prescription medications online. At least for now in Nigeria, as far as I know, you cannot get prescription medications online for very good reasons. The first being that there might be unauthorized persons writing these prescriptions. They have to be vetted, they have to be verified, and this can be done only physically for now, okay? Except there is e-prescription that can be sent directly from the prescriber to the official website or the apps of these online pharmacies. You cannot yourself get prescription medications online. I hope you understand me. That is why if you enter a physical pharmacy, for example, and you are taking a picture of a prescription written by your doctor, it is very hard for you to even still get that medication. Do you understand? Because it must be hard copy. The authenticity must be proven by seeing it face to face. Do you understand? Except you meet somebody who knows you already or is very understanding, or they were able to communicate with that person that wrote the prescription and confirm its authenticity, you may not be able to get those prescribed medications. So getting them online will be a hassle. You still have to go see a pharmacist, go physically with your prescription to get your prescription medications. And I know that you understand what prescription medications I'm talking about, right? The likes of sedatives, hypnotics, some opioids, control medications generally. You cannot get them online. Oh. If you see any online pharmacy selling all those things, just see them as fake because you might pay your money and you not get anything. I'll get there, okay, about what to watch out for. Now, another downside to online pharmacies is difficulty of accessibility of the website sometimes or apps due to network issues, due to website breakdown. Some you will now be hearing this site has been moved, this one you cannot be reached. Some apps they start misbehaving, you don't have access anymore. So a lot of things can happen online that cause glitches to all these apps and online pharmacy websites. It could impede your ability to get your medications on time, right? The downside of online pharmacies is it could encourage drug abuse and misuse. You just stay in your house and order it like you're ordering anything else. Nobody is there to advise you if you're making the right or wrong decision. If you walk into a physical pharmacy now, you ask for a medication, a good pharmacist will go further to probe you why you need that medication. In most cases, especially antibiotics and some other medications like that. You may be making a wrong decision, maybe based on your knowledge or what you've heard from somebody else, but they'll be there to guide you because you've walked in and you've spoken to them. But in your house, there's nobody that sees you now. Nobody knows what you want to use it for. You just order it. I made an example of the likes of Augmentin and Amoxicillin that were all over the internet one time like that. You could just order them and use them anyhow. Nobody will question you. And before you know it, antibiotic resistance sets in. You start self-medicating, you start misusing drugs, you start abusing drugs, and all those other things that come with drug abuse and misuse start happening. You understand? So that is a major disadvantage as well. And the last one, which I want to really emphasize on, is the issue of fake drug distribution. There are so many online pharmacies that they are illegal. I've told you what to look out for legal pharmacies. It must be a registered pharmacy with a registered and licensed pharmacist on ground to talk to when you need. It must have a physical premise. It doesn't really have to be a retailer, but they must have a physical premise attached to them. You can say, oh, our physical premise is located blah 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 in this place. Because a lot of fake websites can be built. Regulatory authorities are trying their best to clamp these things down as they are fake sellers in physical, so they are online. I've told you that some food selling apps, some electronics and clothes selling apps are trying to integrate pharmacies. And you have to be careful which you patronize, really. You really have to be careful. So if you see an app, for example, now, that is not bearing pharmacy, has nothing to do with pharmacy, and is now listing drugs part of the product, you should be wary of those. Do you understand? I think I'm already into what you should look out for in online pharmacies so that you don't become a victim. There are many fake drugs that circulate through those kind of sites I just mentioned. You understand? A site where you can't trace to a physical location, one that there's no chance to speak to a registered professional there. They just list drugs and put their amount. There's no way you can check the expiry date. You have to be wary of those. You have to be very careful because accessing those kinds of medications, you just might be taking fake drugs and it will affect your health adversely. And I've told you another thing to look out for. Do any online platform that is showcasing that they have prescription medications for sale online that you can just order, it is a problem. It's a red flag. It should not be. So this is a call to action for regulatory authorities. They are doing what they can, all right. I'm aware that there's a Pharmacy Council of Nigeria regulation for online pharmacies, and those that are involved in that kind of thing, I'm sure they are aware. There are many requirements that are listed there before an online pharmacy can be allowed to operate. So all these fake pharmacies that are around now, that you just go on one electronic shopping website, you see them listing augmentin, especially when the multinationals were leaving Nigeria. There just see them, they list augmentin, they list amoxicillin and all of that, antibiotics. I've told you that these are supposed to be prescription medication in the ideal situation, but you just see them online anyhow. Anybody can sit in their houses and order them. So if you're seeing things like diazepam, you're seeing benylin with codeine online, know that that is a fake pharmacy. Nothing like that can be in an online pharmacy, even in Nigeria right now. Okay. So what am I saying? Online pharmacies have come to stay, okay? But you have to be very careful where you access these services. And if you are used to your physical pharmacy and it's doing well for you, you can as well continue, okay? But for the convenience and all those advantages I've said, you might want to consider online pharmacy. But please be sure that this pharmacy is authentic, is genuine, they sell genuine product. You are able to speak to a licensed pharmacist even on their app or website, and be sure that you check the expiry date of the product you get from there. I've told you the red flags to look out for on this website. Poorly built website, having controlled medications on their website could be a red flag for fake pharmacies online. And there should be a way in which drug therapy management, patient counseling will still be carried out, even if you purchase your medicines online. All of these are what the regulatory bodies are looking at, such that if you get your medication, how you use it will still be communicated to you. Of course, they are getting it from a physical premise, right? So the instruction for use will definitely be on the packages of the medications. But when you have your questions, you can easily reach out to this pharmacist online and your queries will be attended to. Just as the regulatory bodies are working to make online pharmacies safe for you, you also should watch out. Okay, the onus is on you to watch out for where you get your medications online. Beware of those things that I've talked about, okay, so that your medicine use will be safe for you. It will not cost you more harm than good. Please consider all this when you're trying to choose between your online pharmacy or your physical pharmacy. All are there to serve you and your health needs, okay? To get you the right medication at the right time for the right condition. So please use them wisely. And that is what I have for you on today's episode of the Anti-Pharmacist podcast. Thanks so much, so much for your support for this podcast so far. I see a lot of encouraging comments and likes on my post on Facebook, on Instagram, on LinkedIn. Thank you so much. I do not take it for granted. I'll do a special shout out on Friday, okay? Just to appreciate you guys for what you have been doing for this podcast, okay? I'll be mentioning names, all right? So watch out for that. I see all your likes, comments, shares, on LinkedIn, on Facebook. But beyond that, guys, I still need your support even more than ever before. Don't just like them, don't just share them. Also, listen yourself and leave your comments. I need those comments, they are feedback for me. If there's something you think that I did not say, or something you wanted to hear that was omitted, or you have a question, please ask me. It helps me to know that you're engaging me. Do you understand? It keeps me on my toes. I need that feedback for improvement, guys. And the more you listen, the more you share, the more you like and follow and subscribe to this podcast, the more visibility it gets. That's the goal, guys. I want it to reach the ends of the earth. Thank you for your support so far. It has helped us to reach a lot of countries. I think 15 and counting now, but it's not enough. Oh, please, I want to reach all 180 countries if possible. And with your help, I know that it's possible. I know that it will be done. So please support me, help me, so that once people just go on Spotify like this, Anti-Pharmacist podcast will pop up to them. And that is generated via impressions, the number of people that have listened, that have shared, that have subscribed. So please, I need your support. I told you that this is a passion project. I want people to get the right medicine information. And who better to give them than your favorite qualified licensed healthcare provider and the pharmacist herself? Thank you once again for listening up to this point, and I wish you a very nice and fulfilling week ahead. Till next time, stay healthy and God bless you.